Hey, this is Dr. Brian Brown with another edition of Facebook Live from Core Chiropractic. Now, we get a lot of people that come into the office complaining of sciatica. And what sciatica is starts with pain in the lower back or right in the buttocks. And it goes down that sciatic nerve, it follows the trail, and you can have pain down the back of the leg all the way into the foot. You can also feel other symptoms like numbness, tingling, pins and needles type of sensations. And that's how you know that you have sciatica. Now, a lot of people that come in, we always like to ask a history and kind of see what they've gone through so we can know what has worked and what hasn't worked. And most people have gone the medical route and they take medications for it to try to decrease the inflammation that's there. They even have gone through surgery. Some people have been sent to a physical therapist and they're still here because they're still feeling symptoms from sciatica. And what we like to do is figure out exactly what's causing that sciatica. Instead of trying to just cover up the symptoms that you feel, instead of trying to just cover up the pain or just try to take the numbness away with medication, we want to actually see why you're having the sciatica. And it affects a lot of people. Studies show that it affects 1 out of every 10 people between the ages of 25 and 45. So that's a lot of people that's dealing with sciatica. So what we do in the office to help them to get the relief that they need is we do a full evaluation. We figure out exactly why you're having it. It could be from a number of reasons. One of the most common ones being just an imbalance in the spine and in the pelvis that's putting pressure on those nerves. And so the sciatic nerve is made of the lower lumbar vertebrae, the nerves coming from the lower lumbar. And if you have a misaligned vertebrae there, it can put pressure on that nerve, and that's when you have those symptoms. That's one of the most common ways that we find that it's causing sciatica. Also, when the muscles in the pelvis are imbalanced, and that's due to a imbalanced pelvis. Maybe one leg is shorter than the other, maybe the pelvis is rotated, but all of that can cause imbalance in those muscles, cause the muscle called the piriformis to spasm, and it pinches on that sciatic nerve. But if you just treat the piriformis syndrome with just stretching of that muscle, how did you get piriformis syndrome? So what's causing that? So it's always trying to get to the bottom of the problem and not just trying to take care of the symptoms. Symptoms are the fire alarm, they're not the fire. So anyone that's dealing with sciatica, what we do at the office, if you want to come in and see if we can help, take a full do a full evaluation, take a detailed history. Let's see why you're having that pain in the first place, why you're having those symptoms in the first place. Let us get to the bottom of it, figure out the best treatment plan, and see if chiropractic can help you relieve that sciatic nerve. That's all I have for you for today. I'll see you next time. Have a good one.